All right, good afternoon, everyone. It is 12 o'clock, so we'll go ahead and get started. First, a few announcements. Next Wednesday, we will welcome Dr. Lisa Kulhane, who will be delivering our annual Holocaust Remembrance Lectureship, which is sponsored through the Center for Bioethics and Humanities. This annual lectureship is a critical piece of our Grand Round speaker series, so hope you come. It's, I'm sure, to be a very powerful talk. And then on April 30th, we will welcome Dr. Silvio Inzuki from Yale University. Silvio is an endocrinologist, and he will be discussing an update on SGLT2 inhibitors, which Christine and I see a lot of at Annals these days, so it should be a great talk. A couple of votes of thanks. First, thanks to all of you who attended Research Day this past Monday. It was a wonderful day, true joy to celebrate research, especially in the midst of all that's happening in the country right now, and wonderful to see our trainees, our faculty, and also our invited speaker interacting across posters. So thank you for those that came. And then a reminder, next Monday, I think it's April 21st at 5:30 p.m. in Krugman, is our Faculty and Staff Awards program. You'll see sort of a carousel slide up on your screens. We have some incredible people who are being recognized and nominated. Thanks to those of you who actually put in those nominations. I think I don't need to say this, but it's a wonderful way to celebrate success, and we all need some time to celebrate these days. So if you can come, that'd be great. Again, 5:30 at Krugman next Monday. It is now my distinct honor to introduce Dr. Christine Laine. Christine is editor-in-chief of the Annals of Internal Medicine, one of the most cited / most celebrated journals in general medicine. She's professor of medicine in the Division of Internal Medicine at the Sidney Kimmel Medical College at Thomas Jefferson University in Philadelphia, where she continues to see patients in patient care and in teaching with fellows and residents. Dr. Laine has been with Annals for quite a while. She first joined Annals in June of 1995 as the journal's first general internal medicine associate editor. She was the first woman to fill an associate editor position at the journal. She then quickly became a deputy editor in 1998 and a senior deputy editor in April of 2008. And in July of 2009, she became the youngest and first solo female editor-in-chief of Annals of Internal Medicine, and also a senior vice president at the American College of Physicians. I can go on and on about Christine, but I'll tell you she graduated summa cum laude with a double major in biology and in writing from Hamilton College in Clinton, New York. She received her medical degree from State University of New York at Stony Brook, completed residency training in internal medicine at the New York Hospital, Cornell University, and then a fellowship in GIM and clinical epi at the Beth Israel Hospital of Harvard. She earned her master's of public health degree with a concentration in quantitative methods and clinical epidemiology also at Harvard University. I've worked very closely with Dr. Laine at Annals of Internal Medicine. I can tell you she is extremely active in the world of medical journalism. She has held leadership positions in the International Committee of Medical Journal Editors, the Council of Science Editors, and the World Association of Medical Editors. She's been instrumental in the development of editorial policy at Annals, but also across many journals, including issues such as authorship, conflicts of interest in medical research, and data sharing. And as I mentioned, I've worked closely with Christine in multiple capacities at Annals. I have the pleasure of knowing her personally. She's a thoughtful and effective leader in all that she does. And I think this is the perfect opportunity to talk about the future of medical journals and why we should pay for them. So please join me in welcoming Dr. Laine to Medicine Grand Rounds.
Thanks, Vineet, and welcome everybody. I've really enjoyed my visit here and meeting with everyone. So I'm going to talk about the role of medical journals and a little bit about who should pay. My disclosures, as Vineet mentioned, I'm the editor-in-chief of Annals of Internal Medicine. It makes me a full-time employee of the American College of Physicians, and the American College of Physicians owns and publishes Annals. Annals is a reader-pays, subscription-based journals, and the ACP is a not-for-profit professional organization for internal medicine physicians with about 165 members from the US and around the world. So I'll be talking about my view of the functions that journals serve, and it's evolved. I've actually added a new function this morning after conversations with people yesterday. Entities that currently finance the publication of medical science, talk about reader pays and author pays medical journal models, and then some of my predictions for the future. So what do journals do? Journals filter, improve, disseminate, and archive scholarly work. So not all journals do that, but legitimate scholarly journals do that. And what does this involve? So research is done and submitted for publication. And here comes the filtering part. The journals conduct peer review, and we choose whether we're interested in the paper or it's going to be better somewhere else. I try to avoid the term reject, but that's, it may slip into my lexicon occasionally. If we're interested in publishing, our next role is to help the authors improve that work. So the editors and the peer reviewers provide suggestions for improving the work, and the journal gives the researchers, the authors, an opportunity to approve it. And then we sometimes decide, still not right for us, or we choose to accept it. But our work is not done then, because we have to publish it, and publishing it and just hoping that they will come is not what a effective journal will do. We have to work hard to disseminate what we've published. And we do that by creating paper versions, digital versions, and increasingly coming up with ways to distribute content to readers that's hopefully based on people's interests. So while it can be annoying when you're on Amazon and you look at something and then that something follows you around for months until you purchase it, I think that journals need to do more of that in the sense that if a journal knows what you're looking at, the material on that topic can follow you around for months until you have time to click on it and read it. We interact with the media and the social media so that the reach goes beyond the readers of the journals. We create podcasts, videos, visual abstracts, patient summaries, educational activities related to the journal. And we're still not done because they're really important and increasingly important in the current sort of anti-science environment is to archive the work, to preserve the scientific history and archive. So journals have to work to index, archive, and optimize discoverability. And as you can imagine, that changes over time. Archiving used to mean that we had lots of paper copies that were delivered to the National Library of Medicine and other places. And increasingly, those archives are digital, and the digital technology changes, and we have to keep up with that. So this is what a high-functioning legitimate journal does. But journals also have this role to communicate to our readers. And these are the things that I think our roles are. We try to influence patient care, and we do that by publishing things like clinical guidelines and systematic reviews. And these are examples of some of the guidelines that have been published in annals over the recent past. Journals educate, and some of this is sort of passive education by readers reading what we do, and some of it is providing mechanisms for our readers to get credit, continuing medical education credit or maintenance of certification credit for the time they spend interacting with the journal, whether that's as a peer reviewer or a reader of the journal. Some journals try to advance research methods, and Annals has a research and reporting methods. We have a sort of interesting two-step peer review model where we have statistical methods editors that work from the journal, including Tenjin Ling, who's in the second row here, that help us make sure that we're using currently standard methods for analyzing research. And we publish articles on that maybe our clinician readers aren't quite so interested in, but the people who are clinician researchers, we hope it can help push forward the most current standards in research practice. Medical journals can try to influence policy, and the ACP publishes a good number of policy position papers from the American College of Physicians mostly, and also from some other organizations that address policy topics like firearm injury prevention, meeting the health of America's uninsured, the care of LGBTQ populations. Sometimes this puts journals in uncomfortable positions. So this screenshot is when we published, Annals has published a good amount of work on firearm injury prevention, because our viewpoint and the viewpoint of the American College of Physicians is that this is a public health problem and we need to address it like a public health problem. So we published this position paper. I was invited on Fox News to be interviewed by Tucker Carlson. At that time, I had no idea who Tucker Carlson was. I might have made a different decision after watching some of his interviews, but it's, we did this because it was important to get out to an audience that may not have been aligned with the policies we were pushing out, but to communicate those. It was the worst 6 minutes of my life, though. And journals entertain. So the BMJ has a holiday issue that's very entertaining. They publish cutting edge research like why Rudolph's nose is red, an observational study. We conduct story slams, which are events where we invite physicians and patients to come up to the podium. Sometimes their theme, they're around a certain theme, and people share these oral stories with people, and these stories are published on our site. We publish the very popular On Being a Doctor and On Being a Patient series. We publish graphic medicine articles, and we even have a talk show, Annals Consult Guys. So these things are sort of edutainment, I guess we would call them. And importantly, why do people publish? They publish because they need evidence of academic achievement, and these are the promotion guidelines from Harvard. They're similar promotion guidelines from other places. They all include publications. Sometimes they take account of where it's published, how much it's cited, but all of them take account of how many publications there are. So that's another role that journals help provide the currency for people to document their academic achievement and move along in their careers. This is what I added yesterday after talking to many of you. Medical journals can counter health-related misinformation, and we can do that passively by trying to publish good science. And these are a list of some of the misinformation related to health that's been widely circulating. Armed school police guards have been proven to prevent school shootings. COVID vaccines cause infertility. MMR vaccines cause autism. All of these mistruths that are circulating. What can a medical journal do? Well, yesterday, we published this editorial in Annals talking about the importance of vaccination. Now, do ACP members most of them know that vaccines probably work. But our ulterior motive in doing this was it gave us an opportunity to republish the CDC immunization schedules. So should the CDC decide to alter what ACIP published in any way or take it down from the CDC site, they'll be available at Annals. It's public access at Annals, and I could possibly go to prison for it, but if anybody came to me and said, you have to remove it from the Annals site, I would say, no, we had permission to republish and we're a private entity. So, thinking about this is from the previous Surgeon General's report on confronting health information, and this report put out by Vivek Murthy outlined things that various stakeholders could do to confront health misinformation. And a lot of this report was focused on what social media entities could do, because that's a very effective mechanism for spreading misinformation. But he did make suggestions for health professionals and health organizations, and journals, I think, fall into that. And he was advising that we use technology and media platforms to share accurate health information with the public to hopefully drown out some of the misinformation. So, after reading this report, talking to colleagues, being on a National Academy of Medicine, WHO group, talking about what we could do, I think that the things that we do to combat misinformation is rigorous peer review, so that we're pretty sure what we're publishing represents the current state of the science. But we need to convey the limitations of published studies. And in Annals, the Annals editors have T-shirts that we gave out at one of our strategic planning meetings that say Annals of Internal Medicine, Statistics means never having to say you're certain. And I think that's really important. The way, some of the ways that during COVID that people sort of got in trouble was for dogmatically making statements about what was effective treatment for COVID, what were effective ways of preventing it, what masks would do for the pandemic, without conveying the uncertainty in some of those statements. I think we can publish editorials that emphasize limitations in the work that we're publishing, emphasize uncertainty, like I said, put findings in context, and really specify what the remaining gaps are. So this is what we know. This is what we think this piece added, but there are these important open questions left there. And to really try to avoid hype when publicizing published articles and try to interact with the media in a way that helps get the story right. So we can send out tip sheets that would guarantee wide news coverage of what we do. Our tip sheets get a little, our communication staff write them and then they get a little more boring when I write them because I'm toning them down. But one example is, as careful as you could be, we published a study that showed readmission and in-hospital mortality rates compared to whether the attending hospitalist was a man or a woman. And patients that had a woman as their hospital medicine physician did a little better. All over the news were headlines like, if your doctor is a girl, you'll live forever. So that's not exactly what the study found. So it is hard to control when it gets out into the free world, but we would have been irresponsible if our communication of the editors with the reporters and with the media was sort of emphasizing that kind of clickbait conclusion of the study. And I think we need to increasingly seek to publish work that counters misinformation that threatens the health of the public. So we know, or we recently heard this week, that RFK has put together a team of stellar researchers who are going to figure out the cause of autism by September 1st. That's April now, right? I don't think that's going to happen. And pretty sure, given some of the people that are on this stellar commission to figure out what causes autism, that they're going to conclude that the MMR vaccine is one of the biggest risk factors. So I'm thinking, like, what can we publish that can kind of begin about autism, about vaccine safety, that can kind of preempt some of the misinformation that's likely to be generated from this effort at HHS. And I just added this bit about misinformation literally after talking with some of the faculty yesterday. So again, we'll move on to the who should pay. All of these things cost money. They cost money for the journal. Not all journals pay their editors. I'm lucky to work at one where we do pay our editors who work for the journal. We have to pay copy editors. We have to pay the technology people. We have to pay for the platforms on which we publish. We pay for the paper on which we print. We pay for the postage that mails journals out. We pay to create podcasts and distribute podcasts and visual abstracts. So there are graphic designers who work with the journals. And all of the indexing things also have costs. We have to pay to have the journal indexed in these digital places where they're preserved going forward. So it isn't free. And I don't think anybody thinks it's free, but there is a big question about who should pay. So to think about who should pay, we have to think about who owns medical journals. And the traditional models have been that professional organizations like the Society of General Internal Medicine, the Society of Hospital Medicine, the American College of Physicians, the American Heart Association, and Annals of Internal Medicine, New England Journal, we fall into that group. We're owned by the ACP, NEJM is owned by the Massachusetts Medical Society. Some journals are owned by academic institutions. I list the Ethiopian Journal of Health Sciences here because it's one of our sister journals that we work with, but there are other journals that are owned by Oxford University, Hopkins, that's another model. Some journals are owned by commercial publishers. So the Lancet Group is owned by Elsevier, Nature is Springer Nature. And there was a period of time where there are some journals who are owned by industry. So there was a short-lived journal called the Australian Journal of Bone and Joint Medicine. It was owned by Merck. And not surprisingly, they published a lot of positive studies about their osteoporosis drugs in this journal. That luckily was short-lived because pretty quickly people realized that that journal really wasn't doing all those things on my first slide that showed those wheel of responsibilities of a legitimate journal. And then there are journals that are owned by governmental organizations. So the Proceedings of the National Academy of Sciences, MMWR, and in other countries, there are many examples of journals that are owned by governmental organizations. So non-traditional models have come into play with the open access movement that was started about, I don't know, maybe 15, 20 years ago. So eLife is a nonprofit organization that receives financial support and strategic guidance from the Howard Hughes Foundation, the Kurt and Alice Wallenberg Foundation, the Max Planck Society, and Wellcome Trust. And so it's philanthropy owns eLife. And PLOS Medicine is a nonprofit journal that was started with startup funds from the government, but then now is not owned by the government any longer. It's a nonprofit entity, but not linked to a professional organization. And so the sources of revenue to support medical journals, depending on who owns them, include membership dues and individual subscriptions, institutional subscriptions and site licenses. And for journals like Annals, that second bucket, the institutional subscriptions and site licenses, is actually our largest source of revenue. So these are subscriptions to the VA, to University of Colorado, to site licenses to pharmaceutical organizations. Advertising is another source of revenue, but a declining source of revenue. And it used to be a very lucrative source until direct-to-consumer advertising came into play. And as soon as it was legal in the US to advertise directly to consumers, advertisers realized that was way more effective than advertising to those of us in the room. And the advertising revenue to journals dropped. Reprints and licensing of journal content for use by others is another source of resources, not a huge one. Some journals, like I mentioned, philanthropy, submission fees at some journals, even if they're not author pays, you have to pay to submit, and article processing charges. And so these sources of revenue divide journals into two types: reader pays or author pays. So somebody has to pay, and the author is, maybe it's not directly the author, but the funder, the author's institution. And for reader pays journals, membership dues, individual subscriptions, and site licenses are the primary source of revenue. For author pays journals, it's article processing charges. And so you quickly realize that how is the author pays journal going to make more money? They're going to make more money by having more authors pay, which means publishing more articles, which might mean less of a filtering process. But there are other important differences between these. So I use this analogy a lot. Reader pays subscription models. This picture is of the Barnes Foundation in Philadelphia. Anybody who has not been to Philadelphia, I suggest coming to Philadelphia. It's a really nice, big northeastern city that doesn't get a lot of credit for being a big, nice northeastern city. The Barnes Foundation was owned by an internal medicine physician who made a lot of money from silver nitrate. He discovered silver nitrate, and he has this amazing collection of Impressionist art in a very cool building in Philadelphia. But that's sort of an aside in my push for Visit Philadelphia. But a reader pays journal is like an art museum gallery. So it's curated content. There's a lot of attention that the editors pay to the display and dissemination of that content. In addition to research reports, there are review articles, there are commentaries, there's other educational material that we all, if you're looking at an issue of Annals, there's been some thought into, over time, what are we delivering and presenting to our readers? And those decisions focus a lot on who the readers are. So the readers are like the people that are visiting an art gallery. This picture is the storeroom at the Barnes Museum. There's a lot of stuff in there. If you want to find it, you can go through a process to find it and look at that art. But it's not, it's on these big trays that you pull out. It's not displayed in a way where somebody's thought about what's next, what is next to this, and what is the little explanatory, plaque say next to it. So author pays, funder pays models are more like archives analogous to a museum storeroom. The content is stored. There's minimal attention to the display or to dissemination of it. And most of it is research reports, not a lot of commentary and ancillary material. And a lot of the editorial decisions focus on the authors. How fast are we going to turn it around? How much are we going to charge you to pay for it? How quickly can we get it up online? And both of these models have strengths. A lot of strengths, and there are lots of reasons why people would choose to publish in an author pays journal. But I think it's really useful when you're thinking about what journals you want to look at and where you want to submit your work, to think about which type of journal that you want to go to. And these differences are really reflected if you look at the mission statements of journals. So the mission statement of the New England Journal, it ends with, our mission is to inform health practice. And Annals is, we're enabling physicians to do all these good things to improve the health of the public. PLOS is to empower researchers. So they're not really talking about the public or the clinicians. They're talking about, we're going to empower researchers to get their information out there. So criticism of reader pays journals that led to this whole movement, the start of PLOS Medicine and other pays models, are information that informs health. It's not fair that it's behind a paywall. It's a public good. And particularly when those reports are funded with public resources, they should be available to the public. And it's wrong for journals to own copyright on authors' work. And those are all really valid criticisms, but there are advantages. So researchers in less advantaged settings do not have to be concerned that they can't afford publication fees. So anybody can afford to publish. And while public funds support the conduct of the work, they don't support the peer review or the publication or the dissemination or the archiving of their work. So those funds, even if author pays, other article processing charges are covering for the publication fees, they're not paying for those other things. And importantly, they're not paying for the filtering process. So at Annals, we publish about 5% of the articles we receive. A lot of effort goes into making decisions about the things that we choose not to publish. And if we were author pays, we're not getting resources for that work. And the copyright actually protects researchers from misuse of their intellectual property. So as an individual researcher, if all of a sudden you find misuse of your results that figure from your study in a pharmaceutical ad, yeah, you could sue the company yourself, but it's probably much more of a deterrent if an organization like the Mass Medical Society or the AMA is going to try to follow up on that misuse of the content. And people don't realize that most of the general clinical journals are pretty, like at Annals, we have no problem with authors using what they've published in Annals for their non-commercial use, so in educational activities and other things. But the copyright does protect researchers from misuse of their intellectual property. And subscription fees, particularly when their journals are published by professional organizations, help fund other important organization activities when many not-for-profit organizations, so education, training, advocacy type things. The resources that ACP receives by publishing annals help support things like our advocacy efforts, which do not bring in direct revenue. So making research reports free sounds really great, but these other pays models have created financial incentives for journals to publish more, be less selective about the quality of the content that they're publishing, and the quality can suffer, and predatory journals have really had the opportunity to flourish. And the article processing charges do not cover intensive peer review processes that filter out work that doesn't meet the journal standards. And if payment comes from grants, it leaves fewer resources for actually doing the research. And the CC BY copyright models that many open access journals require, the publishers no longer have legal authority to protect researchers from their misuse of their work. And they also allow commercial use without compensation as long as the entity that's using it for commercial use says where they got the content from. And because the journals help support not-for-profit professional societies, societies may cease to exist. So there are ups and downs of both models. And it can get really expensive. So Nature has decided how much it really costs to publish an article. And it's over, this is a little bit old, but at least 6 months ago, it was almost $13,000 to publish an article in Nature. And this is not crazy. If we did the counting at Annals, it would be high. Because again, we're counting all that filtering process. And I mentioned predatory journals, so this is too small to read, but this is one of many communications that our authors and reviewers have sent where they've been invited to submit their work to the Annals of Internal Medicine from Luna Cruz at an organization called Directive Publications. So we're Annals of Internal Medicine, not the Annals of Internal Medicine. And if you click through all of this to be fooled, you would get misinformation, like the impact factor of the Annals of Internal Medicine is 1.7. Luckily, Annals is a bit higher than that. And if you click through a little bit more and you were gonna submit something, you're gonna have to give up your credit card in order to do that. And if you go to the journal site, there are articles there, but they're not articles that have gone through our process. And these predatory publishers are these ghost entities. They come and go. Our lawyers send cease and desist letters, but you can't really track them down, and they'll go away for a while and come back. And I really worry because there is a lot of pressure to publish, and it is the currency of academic medicine, that a lot of early career people are falling for these entities. And sometimes you pay to have the work published and it never appears. So I want to leave time for questions. So I'll just give a few of my predictions for the future, and I'll warn you that my predictions are often wrong. When I accepted this job in 2009 or 2010, as being interviewed, I said that within my first 3 years as an editor, there would be no more print journals. I was clearly wrong. But so I think that a few high quality subscription-based journals will survive, and I hope that Annals is one of them. I think there will continue to be a proliferation of author pays open access journals. The quality will vary. Some open access journals are quite legitimate, high quality publications, but I think there will be increased numbers of predatory journals. I think we have to continue to innovate in the types of content that we provide readers and the way that we deliver it. I think that print formats will continue to disappear. Electronic features will expand, but I think this conversation about who should pay is not going to end anytime soon. So that's the end of my comments. Welcome to take comments, questions, and my email is on the slide. Please feel free to contact me if you have any questions, comments, and especially if you have interesting work to publish. So thank you for your attention.
Christine, thank you. That was awesome. So for those of us in the audience, you now have the editor-in-chief's direct email. So send your inquiries for Annals papers to Christine directly. Christine, maybe I'll lead us off on the first question. You know, a couple of years ago, there was a lot of interest from the NIH to make government-funded work publicly accessible and available. I know we talked a lot about that. Walk through that for the audience. Like, what were the positives of that, and perhaps some of the challenges?
Yeah. So there was a memo that came out from the White House Office of Science and Technology, Office of Science and Technology Policy. And that proposal was that any government-funded research in medicine, in agriculture, in physics, would need to be posted in the form that the journal was publishing it on PubMed Central the day of publication, so no embargo period. And that had to happen. Now, why would that be bad? Well, that would be bad because the journals would no longer, those institutional subscriptions might dwindle unless the journals were also providing other high value content that was getting people saying it's worth subscribing to the journal because I can get the research in other places. The other problem was there was no mechanism if there was a correction that needed to be made in those articles. There was no mechanism for doing that. They would not be juxtaposing the articles next to editorials or related articles next to that. So the scholarly publishing community, particularly of subscription journals, was quite worried about what this was going to do to the business models. And there also was no increase. If authors wanted to publish and author pays journals, there was no increased revenue to doing that. They also made a statement that all the data had to also be put in this repository, but there wasn't a repository to actually put the data in. So they backed off on that pretty quickly. That policy never went into effect. I guess if we're looking for silver linings of the current administration, I don't think it's on the radar screen. So it might not happen. But we were, kind of worrying about that. And it really there was no recognition. If the government wants what they've paid for to be immediately available, they need to do a better job of making all those research progress reports when you have a grant that you have to write available to the public in like real time. That would really be a better way, I think, of really making available to the public what they do. The other thing is this sense that journals, big bad journals will not make things available to people who are sick and need that information. If we were called by somebody who wanted an article because a relative was sick, we would be sending them that article immediately. And a lot of public libraries have the top tier medical journals in them. You can access them that way. And to pay per view for a journal article usually costs somewhere between $15 and $30. So it's not like a high bar if people want to buy, individual content. I don't know if that.
Yeah, perfect. Thank you. Questions from the audience? Do you have one online?
Yeah.
Go ahead.
Thank you so much for your wonderful grand rounds. One of the online questions asks, has Annals received the letter from the federal prosecutor this week asking about how you discern misinformation and how you achieve viewpoint diversity, et cetera? If so, will there be a uniform front from medical journals in responding to this threat? Or do you anticipate journals doing what many universities and law firms have done, stay quiet, splinter, or even turn against each other?
Interesting, because this morning when I opened my email, the legal counsel for ACP said, we haven't gotten anything yet, but I heard from a colleague about a science journal that just got a communication from the government. So we haven't gotten it yet, and it'll be really interesting to see what happens. My hope is that Annals and some of our peer journals will be more like Harvard than Columbia in our response. We've pretty much said we've preemptively stated upfront when this first happened that unsavory, language that is now banned is not a reason to retract a paper that was published previously. And so I would dig my heels in not to do that. But I don't know a lot of the details about what's been required, what's in this communication. And so far, Annals hasn't received it.
Christine, talk a little bit about ICMGE and how Annals coordinates activities with other journals, because that might be relevant to a united front.
So the International Committee of Medical, there are a couple of organizations that are kind of scholarly publishing organizations. The Council of Science Editors, which is all science all science disciplines, the World Association of Medical Editors, and the International Committee of Medical Journal Editors, which is it's a small volunteer group that started actually back in 1974 or something. And the way it started was because somebody's administrative assistant at Hopkins wrote to journal editors of BMJ, Annals, New England Journal, and Lancet, and JAMA, and said, I'm really tired of retyping my boss's paper every time it gets rejected at one journal. Can you guys, and they were all guys at that time, get together and decide on one format so I'm not retyping papers so much? So the guys got together in Vancouver, it was called the Vancouver Group, and they came to agreement about the format for a research paper. But then over time, as that group stayed together, they started addressing more things like authorship criteria, conflict of interest disclosure, more policy statements. And that group, which is international, there's about 12 members of it. And when an editor leaves a journal, we open up membership and we try to be international, and comes up with recommendations that the member journals say we all adhere to, but a lot of other journals will say we adhere, we're going to follow these recommendations so that less resource journals don't have to reinvent the wheel. We don't police the other journals that say they follow us, so we can't attest to that. But it's a pretty interesting group, particularly in current times. And Annals serves as the secretariat, so we maintain the website, and our senior deputy editor, Christina Wee, serves as the secretary, which is basically, sort of handling the correspondence and kind of herding the cats.
Christine, thank you so much for sharing thoughts on the different journal models. Just a follow-up question on the submissions to Annals. Definitely the open access movement has taken away way beyond the US context, and many of our European colleagues and Australian colleagues just cannot submit papers to non-open access journals. So for Annals, have you seen a decreasing from international submissions over time, or this just all hypothesis?
Yeah, we've actually seen an increase, and the way we track international subscriptions is sort of where the corresponding author is. And we've actually seen an increase in submissions. And when authors submit, they have to check that they read our policy and we don't have an author pays model. And so we occasionally will say, we'll get an article that's funded by Wellcome Trust, and the author will say, oh, this has to be, how much do I have to pay to have this open access? We say, we're sorry, we don't do that. And you check the box and leave it to the author to negotiate with the funder. In every instance, the funder, which most often has been Wellcome Trust, has given the author a waiver to publish an annal. So I think it's, and I think the open access movement in Europe has lost a lot of steam.
There it is. Hi, thank you so much for coming, and thank you for being, open and honest about this, interesting dialogue. I think we can all agree that there's a growing, distrust in both science and in medicine, and I think, some might call it an epistemic crisis. I'm curious your thoughts because I'm pretty sure that growing distrust is it's pretty equal across both science and medicine. It feels like we have a little bit of a natural experiment that more on the basic science side, we have more author pay, and then on the medicine side, we have more reader pay, right? Curious your thoughts on how you think that translates or has an effect on this growing distrust in medicine and science broadly.
Yeah, honestly, I haven't thought about that much, but you really raise an interesting issue. You know, I don't know that the public, I think they pay too little attention to who's paying for the research, actually. You know, sometimes, and it's increasingly, I think that reporters are doing a good job of saying, you know, this trial that showed a beneficial effect of this drug was funded by the entity that markets this drug. So I think it's slowly changing, but I think there isn't a lot of attention paid to, I think most people pay attention to the bottom line more than and if it's being delivered by somebody they trust. And unfortunately, the person, you know, sometimes the people who are trusted most might trust, you know, Gwyneth Paltrow more than the editor of JAMA. You know, so it's based on who they trust and a lot of it is the trust in what they're hearing from people in their community. So I tell a story. One of the residents said, you know, I asked the resident whether they'd recommend a COVID vaccine to the 75-year-old woman. And the resident said I did, but she refused. And I said, let's go in together and see if we can convince her. So I went in and I said, Mrs. So-and-so, I understand you don't want the COVID vaccine. What are your concerns? And she said, fertility. And I said, you're 75 years old. Are you planning to have more children? And she said, no, but I live with my daughter and I want more grandkids. And I said, so what does that have to do with it? And she said, well, my friend who reads a lot told me that if you get the COVID vaccine, you emanate particles that cause infertility in the people around you. Pretty quickly, I realized that at least not in that visit, we weren't going to convince her otherwise, because her trusted entity was not me or the resident that she had just met. It was her friend who reads a lot. Be interesting, her friend was probably reading the New England Journal. So I haven't answered your question. I think I've raised more than I've answered, but I think the distrust, it's a really difficult problem that we have to try to make headway on.
Dr. Laine, could you please share your thoughts about impact factor as a metric to evaluate the journals, whether it can be or is gained by journals, especially those owned with entities that have commercial interests, and whether there might be downstream effects in selecting articles or framing published articles in a way that may maximize engagement, sensationalism, rather than add value.
So quickly, I'll just remind everybody how the impact factor is calculated. So the 2023 impact factor of a journal is based on the number of times material published in that journal was published in the 2 prior years, so 2021 and 2023, over the number of articles published, the citable articles published in the impact factor year 2023. So it's only looking back at citations from the last 2 years. And the gaming part that comes into play is the denominator. So the biggest way to increase your denominator is to have fewer things in it. And journals play games with that all the time because there's very little consistency in whether a review articles and original research are supposed to be mostly what's in that denominator, but journals communicate. So, you know, we learned a few years ago that British Medical Journal, their research articles, their review articles are not in their denominator because they're they call them educational activities. So there are games that are played, and it's a very limited thing. So, you know, a journal can publish articles that are cited for a long time and very influential. It's not in that 1-year impact factor. So, you know, I joke, but I say the impact, you know, post-COVID, our impact factor was almost 56. Impact factor was a very good measure that year. This past year, lousy measure. When it fell in annals. And some of the variability in the impact factor shows that it's not like a stable indicator. So between the last year, 2022 and 2023 impact factor, in a lot of the top impact factor level journals, we all dropped by half. Every single one. So it's very, you know, that variability shows it's not a stable number. And I always say, well, we have to pay attention to it because a lot of the world, that's how they decide where they're going to send their work. So it definitely, it's a weird measure. There are better ways to measure influence, but it's one that unfortunately we currently live with. I worry a lot more when our web traffic goes down than when our impact factor goes down.
Thanks for a terrific talk. My question relates to your comments about the role of print and publication. And it seems like increasingly it's the norm for a subscription to be online only versus print versus both. And then I know several of the things I've subscribed to over the years are now transitioned to online only. So my question would be, how do you, like, what do you see as the importance of actually physically printing and publication going forward? And I imagine with annals, given the way the subscription works, that having like 2 tiers is probably not a, because that's usually like it's cheaper to get online versus both.
Yeah. So I think that the journals, you know, my impression, I haven't looked at it, but the journals that have maintained print are largely journals that are published by a membership organization, and print is something tangible that they can deliver to their members. So Annals, the Mass Medical Society, the American Medical Association, at least for JAMA, AMA now, most of the JAMA network journals other than JAMA are electronic only, but JAMA is still, you know, the physical copy of that. So I think it's to deliver something tangible to members. And it's interesting, we did a survey of the ACP members and asked whether they would, well, you know, what we learned wasn't that surprising, but people use print for kind of, you know, like looking casually through what they want. And then when they want to find something, if they're saying, Annals published in the clinic review on osteoporosis, they'll go online and find that, that thing. So they're using it different ways. But what we learned is that even the younger members still wanted print. So we've continued to do that. I think it has to continue to go away. I mean, I no longer get the New York Times delivered to my house in print because it wasn't coming before we went to work. And by the time I looked at it, I'd already read everything online. So I think it'll change over time. But I think the journals that are maintaining print are largely ones where they have a membership group that they're trying to deliver to. And it's kind of like a reminder, better reminder than an email that you belong to this group.
Thank you so much for the talk. Excellent overview. As we hear that the large publishers are making a lot of revenues in $1 billion for this type of marketing, and is any business modeling where reviewers are going to be paid for their work, you think?
There already are some of those models, and Annals isn't going to pay reviewers. We give you CME credit and MOC credit, but I think that you know, if you're going to pay reviewers, the reviewers would need to maintain a certain level of quality that not all of our reviewers maintain, and that there are reasons, my philosophy is that being a peer reviewer is like contributing to the scientific enterprise. So you review because you want colleagues to review your work, not because you want to be paid for reviewing the work. But there are many entities that are popping up saying that people should be paid for peer review. I don't know that any of the general clinical journals in internal medicine physicians would be reading. I don't know of any of them that are paying peer reviewers right now. I think it's more common in the basic sciences.
Thanks so much for your talk back here.
Okay.
Sorry. So thank you so much for your talk. One of my favorite parts in your talk was talking about the vaccine paper that was published recently, and you're preserving the ACIP immunization schedule. I wonder if you could speak about where there's a world where medical journals start contributing to areas of science that are being defunded on a political level, especially given the knowledge we have around how much money is going into the publishing world, especially given the current political environment.
Yeah, I mean, I think that we certainly, at least I can only speak for Annals, but when USAID was being defunded, we really sped publication of an analysis that was predicting what is that going to do to HIV in Africa? Like, what are going to be the consequences of that? So trying to do that. Was your question whether the journals would be paying for the research? I don't see that that's going to happen. And the entities that are making big money on publishing are like, Elsevier, Springer, Nature. Their businesses, I don't know. I don't see that happening. I don't think it's going to happen at Annals. Journals like Annals will try to publish stuff that will rise up those things. We don't have resources to pay for research.
Christine, thank you for a terrific grand rounds and terrific discussion. I think it was really helpful, and I appreciate the eye-opening nature of the work that you do behind the scenes and the education you've provided for all of us today. So thanks so much.
Thanks for inviting me. It's been a pleasure.